With Michael's case in particular, once again, he's another one of our patients that came to us with a traditional denture on top and a lower snap-in denture on the bottom. And he's in a case where he didn't really like the look of that upper denture. In his case in particular, his bad teeth would kind of cause his sinus infections. And so one thing when we're looking at, once again, we go back to these x-rays, in this area here should be kind of a big black open hole. And when we see buildup and cloudiness like that, it's kind of indicative of a sinus infection, and that can be tooth related or it can be non-tooth related. And in Michael's case, it was a tooth related sinus infection, so they removed the teeth, which helped one of the sinuses, but every now and then you still need to see other ENTs or other physicians to have those sinuses actually cleared up. With Michael, he wanted to do just his uppers, and which we are capable of doing here at Nuvia. If you've got lower teeth that you're happy with, or a lower denture that fits well, or a top denture that fits well, a lot of times we can make our prosthetic and fit the one arch to another one. That's not always the case, as we have to look at the shape of the teeth. Are they in good shape? Is everything's nice and flat? But in a lot of cases, like we did in Michael's, we did end up making and just putting our prosthetic and our 24-hour teeth in just the upper.
All right, everybody, if you have any questions about Nuvia's permanent teeth in 24 hours, make sure you leave your question in the comment section below. Now let's go ahead and meet Michael.
My name's Michael Dorgetti. I got to have some new teeth. I had my teeth pulled and they put false teeth in, and I have real problem with my top dentures. They cause sinus infections. I have some medical problems that cause sinus infections with them, and I can't stand to wear them. They've never been able to get them to fit right. I had really bad sinus infections for a long time. Inside the gum line, the top of the roots where they connect to the teeth started just dying. They went in and fixed them and fixed them and fixed them, and they don't last. I ran across an ad that was telling me about Nuvia, and I thought, maybe this is the way that I can finally have some peace with this. They put them in and they stay in. You don't take them out. They are attached as if they were normal teeth, and the whole thing looked like a better solution to me. You tend to hide your face as much as you can. You don't smile very much because you don't want people looking at your teeth. And it's like, excuse me, I'm gonna go to the restroom. People are looking at you going, that's a meth user. And I'm going, I've never used meth.
I just like being able to see you smile.
It was kind of a blessing to have to wear a mask for COVID because it covered up the problem. And, that's the truth. And it probably is the reason I'm here, is because I understood, because of the mask, how much it had actually changed my life. I love to cook and I love to eat, but I don't enjoy eating anymore. And that's something I have to fix, because at 70 years old and you're 6'4" and weigh 135 pounds is not going to please your doctors. With my dentures in, I can't eat anything that has any kind of small particles, because the way my dentures fit, there's always something under them. Or I can use enough, for lack of a better word, glue, to hold them in, and then you spend 2 hours trying to get it back off at night. And you're never comfortable with it. You're never comfortable with it.
It's got more bone than what we usually deal with, room to work with. He's currently over a lower, snap-on denture. He was talking about before that he feels like his mouth is propped open a little bit, and aesthetically his upper denture is actually in a pretty good spot. And so usually you would want to, if you're going to make height changes as far as a patient saying that they feel like they're propped open, you'd want to make it on that lower versus the upper, especially if the teeth are in a good spot aesthetically. But due to his case, we're probably going to have to reduce a little bit more in order to make him happy and kind of get his bite back to where he feels like he's not quite propped open as much.
We hope you're as excited as we are to see Michael's new smile. If you are, go ahead and like this video, subscribe to our channel, and turn on that bell notification so you're always up to date when we post new content. Now let's get to Michael's transformation.
Looks better.
Your face looks normal again.
It's best I can remember. It feels like we always did before. It feels natural. It's been 3 years since I had a full mouthful of teeth that worked, that I wasn't trying to hold in. Surgery date was okay. It wasn't too bad. It was just getting used to the feel of the teeth in my mouth again. It's really the biggest thing. It was great. It made my face fill back out again, and then I could eat again. My favorite is eating. I've already gained like 9 pounds back now. And I was down to where the doctor was complaining about my weight being too little. It's better to be able to look in the mirror and you look younger or whatever. It's, you know, you look more like you're used to. First thing I ate was vegetable beef soup that I make my own, and it's got lots of vegetables in it. I plan on going out in public more and probably do a little more traveling again now. They say you can't taste with your palate, but without the denture part going across my palate and closing it off, food tastes better. It feels better, it tastes better. And I can't explain any more than that. It's more enjoyable to eat again. And the sinus infections, so far, I haven't had one, so it's helped a lot. Your body remembers rather quickly what it was like to have real teeth in, and it's not very much difference. I don't notice much difference between the implants and when I had teeth. It's been a really nice experience. They've always been laughing and joking with me and having a good time, and they're very happy and act like they're glad to see you and very helpful. It's not like you come in and they go, well, we're going to have to do this, and now you sit there and just be quiet and we'll get around to you. It's been an ongoing experience with getting to know each other a little bit, and you know, so it's been a lot of fun. The damage that was done from sickness with my teeth, they were going to have to come out. There was no doubt about it. It wasn't, you know, something that I could control. I wasted 2 years trying to deal with dentures that were never going to work. Anybody who is considering this rather than dentures, I would absolutely recommend this. Don't go the other way first. Come here first and get it done. That's the only way to go.